My particular area of research here at RHI is on how to help people get back to work after brain injury and stroke. I think what's unique about RHI, it's not that we just provide therapy services. We provide whole programs that take into account all the barriers that our people face when they're trying to get back to life. And it's that comprehensive, it's that human, holistic perspective. Hi, I'm Lance Trexler, and I'm the Executive Director for Rehabilitation Neuropsychology and also the Resource Facilitation Program here at the Rehabilitation Hospital of Indiana. We've developed now a new intervention called Resource Facilitation for folks that have had a brain injury to help them get back to work. That has positioned RHI now as really the leader nationally in outcomes for people with brain injury. And based on our findings, the state supports this resource facilitation program for people throughout all of Indiana, and we're getting people back to work at about 70% of the time. The state was getting people back to work at 18% of the time. So we have people, we have about 350 people now in our program throughout the state, and staff all over Indiana providing this service, but as directed through RHI. We also worked with some researchers at Ball State University, and we found that Indiana, because of that research, is saving about $80 million a year for people getting back to work that they wouldn't be capturing otherwise. And actually, because of the support we get through the RHI Foundation, we were able to do that study that now results in thousands of people getting back to work, starting off with about $24,000. But the RHI Foundation seeded that possibility. So without that seed, we wouldn't have, of course, been there. I think it's really important for donors to understand that we flip science to care. We don't practice evidence-based medicine. We create the evidence and then practice from the evidence. So RHI is a petri dish in which science and knowledge is developed, from which that drives patient care, and not only patient care, but new programs that wouldn't exist otherwise. RHI has allowed myself and our team to innovate and to take some risks, develop ideas, move them from ideas to research, from research to service. We knew that we were making a difference, and our patients love the service. But when they saw the results that 70% of the people returned to work, as opposed to 18%, I think they, of course, became extremely proud. From the day they start rehabilitation, most of the time, return to work is their goal. That's what they're looking forward to. And so they, of course, get really excited when they see that coming and it happens. But then the family reaction is equally as profound, because and maybe a spouse has had to go back to work and try and take care of the kids, or they're fearful that that's going to happen. They're fearful that they're going to lose their house. They're fearful of what's going to happen to their kids. How is that affecting their whole family? And so the spouses, the kids, everyone just gets really engaged in this process, and they take that first step here in the hospital, but they take that step into their work when they come through our program. And RHI is the only place I know of in the country where you, in a single system, can start at the emergency room and end and return to work and not leave that system. So I think that feeds the energy of the team also, but I think that when you see the patients and their families respond, it's hugely rewarding.